Today's topic is gestational diabetes mellitus. In this video, you will learn about what is gestational diabetes mellitus, what is diagnostic criteria for gestational diabetes mellitus, pre-pregnancy counseling, management during antepartum, intrapartum, and postpartum phase, mode of delivery in case of gestational diabetes mellitus, and fetal, neonatal, and maternal complications due to gestational diabetes mellitus. So let's start. Diabetes may complicate a pregnancy either because a woman has type 1 or type 2 diabetes mellitus before pregnancy or because impaired glucose tolerance develops during course of her pregnancy. Later is known as gestational diabetes mellitus. Next is the diagnostic criteria of gestational diabetes mellitus. According to NICE guidelines, gestational diabetes mellitus is confirmed when fasting blood glucose levels are greater than or equal to 100 mg per deciliter or the 2 hours plasma glucose is of 140 mg per deciliter. According to WHO guidelines, gestational diabetes mellitus is confirmed when random blood glucose levels are greater than or equal to 92 mg per deciliter, 1 hour plasma glucose level is greater than 180 mg per deciliter, or the 2 hour plasma glucose level is equal to 153 mg per deciliter. So, this was the diagnostic criteria of gestational diabetes mellitus. Next is pre-pregnancy counseling. The aim of pre-pregnancy counseling is to achieve best possible glycemic control before pregnancy and to educate diabetic women about implications of pregnancy. The advice includes optimization of glycemic control, keep the HbA1c less than 42 millimole per liter. Then we prescribe the high dose of folic acid 5 mg daily to reduce neural tube defects or to prevent the neural tube defects. The planning preconception adjustment of other drugs or medication. Next point is very important. You must educate the woman about all the risks of gestational diabetes mellitus. Now, the important UHS exam question comes that write down the management of gestational diabetes mellitus or write down the antepartum, intrapartum, and postpartum management of gestational diabetes mellitus. So you will write the answer like this. Antepartum management includes glucose control, which further includes maintenance of normal glycemia, advise exercise and maintain diet, glucose monitoring 7 times per day, adjust by insulin and metformin. Next, the CTG fetal surveillance is done from 20 to 24 weeks of gestation. And we prescribe low dose aspirin from 12 weeks onward to prevent the preeclampsia or eclampsia. Next is intrapartum management. In case of low risk patients, wait for spontaneous labor till 40 weeks of gestation. And in case of high risk patients, induce the labor at 38 weeks of gestation. Next, it is very important to decide the mode of delivery. In case of low risk patients with no complications, the vaginal delivery is done. And in case of high risk patients with complications, the C-section is done. Now, when the baby has been delivered, the postpartum management includes the re-evaluation of glycemic status by 75-gram oral glucose tolerance test, which is performed at 6 weeks and 12 weeks respectively in postpartum phase. Next, again, is an important repeated SEQ question from the UHS exams that what are the complications of gestational diabetes mellitus, or write down the fetal, neonatal, and maternal complications of gestational diabetes mellitus. So, the fetal complications include macrosomia, stillbirth, miscarriage, hypoglycemia, shoulder dystocia, which may be due to macrosomia, then risk of congenital malformations is present. Next, the neonatal complications include ARDS, acute respiratory distress syndrome, birth aphasia, hypoglycemia, hypocalcemia, hypomagnesemia, hypokalemia, and hyperviscosity syndrome. The maternal complications include preeclampsia, shock, risk of infection, increased rate of operative delivery, the condition known as polyhydramnios, premature labor, premature rupture of the membranes, and postpartum hemorrhage, which is a medical emergency. This was all about gestational diabetes mellitus. Do not forget to like and subscribe my channel.